Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is briefly made clear and often illustrated. Let's start. Today's topic is about the anatomy of the middle ear. This is how this presentation will be clarified. Definition of the middle ear, location, the different ossicles, malleus, incus, stapes, the function of the middle ear, the different wall, lateral or tympanic wall, medial or vestibular wall, anterior or carotid wall, posterior or antral wall, roof or tegmentum, floor or inferior wall or jugular wall, the function of the middle ear. What is the middle ear exactly? Middle ear, as its name suggests, is enclosed between external ear and inner ear. It is an air-filled cavity within the petrous part of the temporal bone. Under the floor of the medial cranial fossa, medial cranial fossa, is the middle ear. There is an anterior wall, a posterior wall, a roof, and lateral or tympanic wall. From the intracranial view, anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. Here's the foramen magnum, pinna and external auditory meatus, internal acoustic meatus or auditory canal, and inner ear and cochlea. Another way to show the middle ear, here's the petrous part of temporal bone, here's the middle ear, here is the cellular, and of course inside of middle cranial fossa. We recognize the foramen lacerum, the foramen ovale, and the foramen rotundum, in addition of superior orbital fissure. Pinna and external auditory meatus, petrosal part of temporal bone, posterior cranial fossa, anterior cranial fossa, and middle cranial fossa, middle ear, and internal acoustic meatus. This is the Eustachian tube. Middle ear is buried in the petrous part of temporal bone. The petrous part of the temporal bone must be dug from above in the middle ear, cranial fossa to find the middle ear. Another way to show the middle ear, the anterior wall or carotid wall, the posterior wall or mastoid wall, the lateral wall or membranous wall or tympanic wall, the medial wall or labyrinthic wall. I repeat, anterior wall or carotid wall, posterior wall or mastoid wall, lateral wall or membranous wall or tympanic wall, and medial wall or labyrinthic wall. Here's the inferior wall and here's the roof. Under the floor of medial cranial fossa in the middle ear, anterior wall, posterior wall, the roof, lateral wall or tympanic wall, and from the front of the middle ear there is tube going forward medially and little bit down to the nasopharynx. It's the Eustachian tube air pressure equalizer. Backward behind the middle ear, posterior wall or mastoid wall. There is an extension opening hole called auditus, extended backward into an air-filled space called mastoid antrum, connecting to mastoid air cells. Sometimes, in the posterior cranial fossa sigmoid sinus, connected to brainstem and cerebellar infection of mastoid antrum can extend backward to the sigmoid sinus combined thrombophlebitis. Under the floor of the middle ear there is a jugular fossa and internal jugular vein. 3 main nerves, the glossopharyngean 9, with its tympanic branch, the vagus nerve 10, and the axillary 11. Middle ear is bilaterally compressed. It's a cavity. It's a biconvex cavity. Here is the pinna, the external acoustic meatus. Here is the roof, and here is the floor. The tympanic membrane between external acoustic meatus and middle ear. 15 millimeters high, 15 millimeters deep, 6 millimeters, 2 millimeters, and 4 millimeters. This upper part is the epitympanic recess. This lower part is the tympanic cavity proper. Ossicular chain: malleus, incus, and stapes. 3 small ear ossicles. The purpose of this arrangement is to pick sound energy from tympanic membrane, to trigger oscillation of the chain, to transfer from external air to the internal air. Inside the middle ear, the roof, the anterior wall, the posterior wall, the medial wall, and ossicles, malleus, incus, and stapes. Another view of malleus and another view of stapes. Malleus, there is a head, anterior process, and a handle. What about incus? A body, short process, and long process. And for stapes, there is a head and neck, limbs, and foot plate. Inside the middle ear, anterior wall, posterior wall, the roof, and the medial wall. From the medial wall, there is oval window, round window, and promontory. When stapes vibrate in the oval window inward, it creates vibration in the liquid perilymph. Knowing that fluid is incompressible vibration are transmitted from the scala vestibula to scala tympani through helicotrema, moving the round window outward. It produces stimulation in hair cell of cochlear duct. Mechanical energy is converted into electrical current, taken by neural system to the central nervous system. Here is the middle ear, here is the oval window, here is the round window, and here is the cochlea. The cochlea in the inner ear is rolled into a spiral-like snail. If we unwind this system, we get the following form. Oval window, a round window. Here is the oval window. This is the scala vestibuli, and this is scala tympani. Between scala vestibuli and scala tympani, there is helicothema. Between both of scala, there is a scala media. Fluid is incompressible and transmits pressure into the round window. The consequence is to transmit a stimulus to the higher cell that transform mechanical energy into electrical energy. The function of the middle ear is to transfer sound energy from tympanic membrane to allow vibration or oscillation of malleus and incus and stapes, then transform sound vibration from external air to internal air, from the external air to the internal air through ossicle chain, and transfer this energy to inner ear. Inner ear is a bony canal hosting cochlear deck. When sound approaches the tympanic membrane, it oscillates. Frequency of oscillation are transmitted through ossicular chain to the footplate of stapes, which feed in a window colored oval window. That communicate with inner air fluid called perilymph. Inside membranous duct is endolymph. Vibration of stapes are transmitted to perilymph of scala vestibuli to reach scala tympani, from scala vestibuli to reach scala tympani. Pressure is moving outward to round window elastic membrane. Both scala meet in helicothema. Vibration or perilymph are transmitted to higher cell. Mechanical energy is transformed into electrical current through cochlear nerve to the nervous system. What is the function of the middle ear? The function of middle ear is to collect sound compressible air energy from large tympanic membrane and amplify this energy through ossicle chain to apply the energy for a small window to incomprehensible pressure. Tympanic membrane is 17 times larger than oval window. In addition to the leverage action of 1.3 unit, intensity of vibration is changing, but the frequency of vibration is the same. Total is 21 to 22 times. Let's move to tympanic membrane. Inside the middle ear, the roof anterior wall, posterior wall, medial wall, and tympanic membrane. Anterior cranial fossa, middle cranial fossa, posterior cranial fossa, suture ceca, and here's the middle ear, the anterior wall or carotid wall, the posterior wall or mastoid wall, the medial wall or labyrinthic wall, and the lateral wall or membranous wall or tympanic wall. Is the roof, the inferior side is a regular side. From a sagittal view, anterior cranial fossa, middle cranial fossa, and posterior cranial fossa, here's the middle ear, and here's the tympanic membrane. When you project the light, it is a semi-transparent membrane. There is a radial fiber of collagen, and superficial circular fiber are deeper. A handle of malleus directed downward and backward. Lower part of the membrane is stiff and rigid, and the upper part is loose. Membrane is fixed into a bony sulcus, which is superficially deficient. 3 reasons. Upper tissue is very loose, handle of malleus pull in, and the deep part is rigidly fixed. Is a bony sulcus, and here's the embout. 3 layers of membrane. Cuticular layer or skin layer, fibrous layer in green, and mucosa from endoderm of middle ear. 3-layer membrane, external skin from ectoderm, handle of malleus, medial fibrous from mesoderm. And mucosa from endoderm. Embout is part of tympanic membrane, the most central. Depressed part of tympanic membrane at the tip of the handle, or at the tip of the handle of the malleus. This, the green, is part flaccida, and this is part tensa. The handle of the malleal handle is the embout and the cone of light. Pars tensa, pars flaccida. The posterior mallear fold and the anterior mallear fold. The long limb of Lancus, the stapes posterior limb, and tendon of stapedus. Here's the embout, mallear stria, and mallear prominence. The cone of light, or light reflex, tympanic membrane with otoscope, in the anterior inferior quadrant, 4 o'clock to 5 o'clock position. Clinical significance. If membrane bulge in or out, angulation is modified. The surface is not flat, but slightly arched concave. It is not vertical, but inclined 55 degrees with respect to axis of external meatus floor. Roof of external meatus is small, and roof is long. Clinically, foreigner body lodged in the angle. Syringing from the roof to press the foreigner body outward. Nerve supply to tympanic membrane. Outer part of membrane supplied by the auriculo-tympanic nerve, branch of mandibular vitri, a division of trigeminal nerve. Supply tympanic membrane from outside. Auricular branch of vagus nerve which lodge some favor from facial nerve. Inside, it is supplied by glossopharyngeal nerve through tympanic plexus. Severe pain referred otalgia in the teeth, referred pain in the air because mandibular branch. Vagus nerve supply also the heart. If vagus nerve is irritated in the air, it produces autonomic reflex for the viscera, may have cause of reflex bradycardy. Syringing aggressively the air stimulates the vagus nerve that produce bradycardia. Few fiber from facial nerve because geniculate ganglion, virus of herpes zoster is latent, severe pain, hemorrhagic bluster facial paralysis, causing Ramsay-Hunt syndrome. Old smoker in outdoor has a plug in the air and split a blood in handkerchief, maybe cancer of the tonsil of the posterior third of the tongue. The anterior wall, Eustachian tube, is responsible to communicate the air from the nasopharynx of external world and air space in the middle ear. To keep the pressure in the middle ear equal to the external environment, it is air pressure equalizer. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.